you go on vacation and your practice also goes on vacation. This is what commonly happens with every practicing dentist. And I'm sure it's your dream to build a practice in such a way that your practice is functioning in your absence as effectively and impactfully as in your presence. It should not happen that the moment you are out of scene, your practice collapses. And this is what exactly I'm going to talk in this video, which will help you to build a practice which will function in your absence, and eventually you can automate your practice. So don't miss even a single word in this video. Hi, this is Dr. Sujit Pardeshi, an international speaker, bestseller author, and someone who has helped more than 6,000 dentists from 18 different countries to build their practices at an absolute magical speed and equally magical levels. So, why it happens that you go on vacation, or the moment you are not in the clinic, your practice doesn't remain same? The problem is your practice is person dependent rather than system dependent. When the practice is person dependent, that means it is completely dependent on you. Your patients does not allow anybody else to get the treatment done from. Your staff does not function equally well in your absence, and neither the different tasks and activities or whatever work you have that gets completed on time and equally well when you are not there. If this happens in your practice, that means your practice is person dependent. Now, the system dependent practice is such that the system is set, the ball is rolling, it doesn't matter whether the person is there or not, or whether person A is handling the matter or person B is handling the practice. So it should not matter. So how to build a practice which works on auto mode? And you need to work on the 3 magical letters, and they are called PSS. The processes, systems and structure. You need to develop the PSS in the practice. Now, in simple words, this is also called SOP, the Standard Operating Protocol. But why I call it PSS? Because it's a very detailed and elaborative version of developing a practice which can run on auto mode. Now, the first P is the processes. What do you mean by a process? Processes are every single task and activities that are carried out in your practice right from the moment your clinic opens till you close the clinic at night. So you need to make a complete list of every smallest possible task and activities that is carried out on daily basis. Like for example, who is going to open the clinic? Okay, right from opening the clinic till the housekeeping stuff, till the appointment management, till the telephonic calls, the chairside assistants, the sterilization protocol and everything. So make a list of all the tasks and activities that happens in your practice on daily basis. Now once you make this list, you need to go one step ahead and make a list of weekly and then monthly tasks that happens. Because I'm sure there is some work that you have to do only once in a month. Like for example, paying the bills. So once you make the list of all the daily, weekly and monthly tasks and activities in detail, then your processes are ready. This is called process. Now the second important word is the system. Now what do you mean by a system? System is how will you measure whether these tasks and activities are done properly or not. Like for example, sterilization. Now sterilization is a very critical and important step or process in your practice, and it has to be done properly. So you should have a measurement matrix, a tracking mechanism where you will be able to measure if the sterilization is done consistently on time and properly or not. So one of the simplest way to do is to just make an Excel sheet, and every single time, no matter who do the sterilization of instruments in your practice, they just need to write down the date and time. So you will have a proper tracking system where you will know when was the sterilization done, how frequently it is done, and this is called system. So that means every single task and activities should be done properly. And you should have a tracking mechanism where you are able to measure the results, the quality of the work which is done properly or not. Now, once you set the system, very important thing while setting the system is there are certain very important processes. We call it as KRA, that means key result areas, where the measurement is very important. I'll give you another simple example. The patient's lab work goes to the lab and that crown or bridge or that prosthesis comes back from the lab. Now, if you do not have the proper measuring or tracking system in the practice, there is a possibility that the patient is there sitting in the dental chair to fix that crown, and then you realize or you come to know that the lab has not yet sent the work. I'm sure this has happened to your practice at least once in your life. So this is a very critical or important measurement area where you must know that the lab work is in the clinic before patient's appointment and the patient is in the dental chair, so that you don't get any negative surprise. So such important processes are called KRAs, key result areas. So whatever list you have made out of the processes, you set out or you make a separate list of the important key result areas. Now, once you have the KRAs in place, put the measurement matrix at least for the KRAs. Once that is done, the third important letter is the structure. That means who is going to do which task and activity in your practice. This has to be properly defined and written in front of every process. Like for example, who is going to open the clinic, who is going to do the sterilization, who is going to do the tracking of the lab work, who is going to make the phone calls. I hope you got the point. So for every process, there must be someone who is assigned to do that work. So processes is the list of all the tasks and activities. System is the tracking mechanism of the results if they are done properly or not. And structure is who is going to do which task and activities in your practice. Once the PSS is in place, that is where your practice takes first step towards automation. It's not everything, it's not final, because the PSS is the theoretical work you need to do. And then the next step is building the team which will follow this PSS, and eventually your practice will become system dependent than the person dependent. It will take years to make it happen in your practice. So even if your practice is new, trust me, even if it takes like 3 to 5 years, it is still worth, simply because building a practice that can function and even grow in your absence is a worth task doing, irrespective of the time, efforts and the focus it takes from you. Put your comment in the comment box. How did you find this video on automating the practice? And share this video with one of your friends who really needs automation of the practice. Subscribe to this YouTube channel and do not miss any such content in the video. I'll see you again. Thank you.